our thoughts on the stuff that's happened this week.
I guess like what were our learning objectives and what did we do today? So it's been a long session, hasn't it? So we covered the unanimous vote to reject the GP contract, which I think we all expected, and I think what happens next, is the big question. I was going to say at the time that there's going to be some public, some patient and professional consultation sessions run by the BMA to think about what will be appropriate in terms of industrial action. So that sounds like a really, really sensible way to get patients on board, or at least consulted with what's happening next. The next story that we did was around the GP contract. Did you have any take home from that, Gandhi?
So the GP contract is similar to the episode we covered about a month or so ago. You're welcome to have a look at that. Alternatively, you can absolutely join us live next week where myself and Andy will go through the GP contract, the PCN DES contract, and the QOF contracts in more detail to go through the exact changes. There are some subtle changes that have happened since the original letter. And important to recognise this will be the imposed contract, the third year in a row that it's going to be imposed on general practice in terms of what is required from us. Still raise that question: what happens if you act on a contract that you haven't agreed to or your union hasn't agreed to? But hey, we'll be there.
You can't remember, we covered this last year as well. It's this, they use the statutory instrument to push it through. They can do it. They've got the power. They're the government. So we then talked about the story that made the mainstream media about the lowest patient satisfaction with the NHS since records began, which was 1980, for this particular survey. 24% approval, or 24% people are satisfied with the NHS. And we dug a little bit into the study that was behind that, the British Social Attitudes study that's been published every year since 1980, and had a look at some of the themes in those questions around the NHS, with actually people, whilst being dissatisfied, still very supportive of those basic principles of the NHS: free at point of delivery, universally available to everybody, and paid for out of general taxation. So that was an interesting story. After that, we talked about NHS funding, didn't we, Gandhi? Did you have anything to round up about general funding of NHS and primary care and effectiveness of primary care? We looked at a paper that looked at the effectiveness of primary care.
And effectively, that showed that actually, if you invest in general practice and primary care more effectively, then that has better health outcomes for the population. And also, comparatively, we looked at the levels across both ourselves and other countries and showed that actually England is lower than majority of the other countries, particularly ones of equivocal, westernized population data kind of thing.
Western European countries.
Yeah, but also the amount of GDP investment is actually less this year compared to previous years, which absolutely has a factor in that. And then finally, then we talked about the Physicians Associate and Anaesthetic Associates consultations by the GMC, which we'll put links to that down below if you want to have your involvement in that consultation. We'll take about 20-30 minutes or so to go through once you've read the documents and stuff. But it may be useful for you to have your say, both as a clinician, but also a wider team. Would recommend doing that. And then we finished off, Andy, with?
We looked at the guidance that hospital trusts must instate a designated lead for improving interface with GPs. And we talked about the coincidence of timing of that coming a week after Claire Fuller visited Nottingham City and talked about the work being done on just that issue in Nottingham City. But I mean, I felt that was quite positive, actually, and that positive things can come out of that work and that increased coordination between primary and secondary care. Issues like signing of sick notes, how shared care protocols run, things like that. Lots of scope for improvement.
And just to point out that we've still got well over 100 people live with us today. So what have we got to wrap up with? Well, a couple of things I am going to mention very briefly for you all. So number one, myself and Andy only have about 2.5 weeks left till our PCN Plus live conference. It is fully booked out in person. However, you can absolutely join us remotely if you want to do so. And when that's with ourselves, Ben Gowland from the GP General Practice podcast, and also Tara Humphreys from the Business of Healthcare podcast that Andy's trying to put the thing up. Sorry, I thought he had it up and it's gone.
Still behind the curtain. You're still behind the curtain.
Yeah. So Okay, well, let's have a look at that. So if you do want to join us remotely, absolutely feel free to do so. It's an amazing conference. We've got some awesome content coming for you, and you will absolutely get to hear both mine, Andy's, and Tara and Ben's perspective on all the stuff that's coming through, as well as how to make your network and local area function so much more effectively. Got a little photos there as well. In addition to that, if you want to check out some stuff Tara's been doing, which I would really recommend doing so, there's a link to the Primary Network members club that she's got, which summarizes a lot of the GP contract changes in a reading format. So obviously myself and Andy do audio visual. Tara's much better at the blog formats and stuff. And if you want to have a look at that, feel free to do so. Next, after that, so in 4 weeks' time, myself and Andy have got our GP5T7 conference that we're doing here in Nottingham. There are about 10 spots left if you want to join us in person. So, feel free to do so. It's an awesome conference. However, remotely as well, if you want to join us, do feel free to do so. It's going to be interesting. We've got some awesome content. I'm also going to be doing something that I don't think I've seen anywhere else, and that's covering AI in GP training. So this is the only place you're going to see it. And we've got some awesome things from Medics Money. We've got some sessions on humanities. We've got our Ask Us Anything panel as well. And if you are joining us in person, you'll get lunch provided, as well as some cool things that we've got planned. I may even get some extra surprises in there for people. And then more recently, I've started filming the Epic series for eGPlearning. So this is our eGPlearning podcast, Podblast, implementation consultation, hence why it's called Epic. Already got 2 episodes done, so they'll be coming out after Ramadan's finished and things. And it's basically how change happens in general practice, learning from our peers, learning from your fellow eGP learners. And you can join me on this if you want to. So you just need to apply down below and stuff. So feel free to do so. Any thoughts on the other stuff going on, Andy?
Gosh, I think you've covered it all, and I'm sure people are absolutely tired out now with all of the stuff that that has been going on and the stuff that's available. I suppose just join us next week for that for the review of the new contract documents as well. We'll spend some time over the next week having a look and try and summarize some key points.
So this is the episode you want to join us for. Make sure you subscribe, get the notification link and stuff. It's already up there on the YouTube channel if you want to make sure that you're registered to join us for free, and as ever, because it's on YouTube and things. Or if you're joining us on any of the other platforms, Facebook, LinkedIn, etc., yada yada yada. And we will absolutely continue to help improve things. That episode will be coming up right about here when it's we finished processing this episode. Alternatively, if you want to check out the previous one on the contract, that's coming up right here. And as always, we'll be here to tech enhance your primary care and learning. Have a great bank holiday, everyone, and we'll catch you in the next episode.